Stent thrombosis. Introduction. A stent is a wire mesh tube that opens an artery when it is blocked. Select true or false. Correct. Stents are placed during a procedure called angioplasty. Stents help treat chest pain and can prevent heart attacks. Stent thrombosis does not always cause symptoms. Select true or false. Correct. Symptoms of stent thrombosis may include pain, swelling, and pressure near the area where the stent was placed. Stent thrombosis happens when a blood clot forms in an artery where a stent was placed. Select true or false. Correct. Which of the following medicines are used to treat stent thrombosis? Choose one of the following options. 1. Anticoagulants. 2. Antiplatelets. 3. Thrombolytics. 4. All of the above. Correct. The amount of medicines you take, the way you take them, how well they work, and the length of time the drugs work depend on which medicine you take. Thank you for using Explain.